If you feel tired all the time, even when you're trying to do everything right for your health, that can obviously be confusing and frustrating. You might be sleeping more, moving more, eating better, and trying to be consistent and yet still feeling off. And at some point, it's easier to sometimes believe what you may hear, that it's just part of getting older, or stress, or that you're working too hard. But fatigue is one of the most common signals that your body sends you, and it's also one of the easiest that is written off in our conventional paradigm. I'm Dr. Kenny, IFM certified functional medicine practitioner, and I spend a lot of time helping people make sense of the patterns behind their fatigue. Because what I can tell you is that fatigue, though it's common, is rarely random. And instead of pushing through it like many of us and society has us believe is the right thing to do, sometimes slowing down and asking questions about what your body is trying to communicate is a better start. So rather than just asking why you're tired or covering it up with caffeine, let's try and look at what your fatigue might actually represent underneath the surface. When most of us think about fatigue, especially when it affects our life, our performance, our family, most people think it's something we just need to make go away as quickly as possible. How do I get more energy? What am I missing? What should I take? But perhaps a more root cause way to look at this is to understand that your fatigue is often a signal that your body's been operating in some sort of energy debt for longer than it can keep up with. Every day, you're either netting out and putting energy back into your system or drawing from it through our actions, through our thoughts, our environment, and our other inputs. Sleep and adequate nutrition or rest and recovery time put energy back in, whereas stress or poor sleep quality, hidden inflammation, or overextending yourself actually withdraws from your resources. I find most of the time in clinical practice, fatigue doesn't come from one single event. It often builds up gradually and sneaks upon us when your withdrawals are slowly outpacing your deposits. And the tricky part is that our bodies are highly adaptable. So many of us are adapting to these changes without truly recognizing what's happening in the efficiency of our energy systems behind the scenes. You can still show up and function well, get things done throughout the day, and yet quietly underneath the surface, the system is working with less and less of a margin every day. So a deeper question we're going to orient around, rather than simply fixing fatigue, is going to be, where is my system losing energy and why hasn't it been able to recover? And when you start to orient deeply around this question, when we start to talk about fatigue patterns, it's going to help us make a lot more sense of them. To make this more practical, most of the common drivers of fatigue can be broken down into one of two categories. The first is environmental. This is everything that's happening outside of your body, like what your day-to-day looks like. What are your environmental exposures or your work-related stress, family demands? Ultimately, how much demand your environment and the world around you is putting on your systems. And the second category is internal. This includes everything that's happening inside the body, from chronic stress chemistry activation to your nutrient status, also your sleep chemistry and biorhythms. Ultimately, how efficiently your system is functioning overall. And this distinction is helpful practically because it gives you a starting point. You can ask yourself, when you're feeling fatigued, do you believe that this is something coming from your environment or something internal? Or perhaps a combination of the two. But these two don't stay separate for long. They're difficult to separate because your environment eventually begins to shape your internal chemistry, and your internal chemistry shapes the capacity you have to respond to your environment. So let's start with the environmental side, because this is where we have the most visible control into affecting where our early fatigue debts might be coming from. And while the environmental ones are visible or often scannable, they may not be obvious in many of our lives. The environmental factors that can lead to fatigue show up in several consistent ways. First, and perhaps one of the most direct draws from your energetic piggy bank, is chronic stress. This is stress that never seems to fully resolve and carries on to the next day, week, or month. And for many people, this shows up in work, in relationships, and in family dynamics as well. Second, and this may be obvious, but also not for some people, especially the night owls or those who really power through with 5 hours of sleep. Second is sleep that gets shortened or fragmented over time. This may seem obvious, but In terms of practical application, and especially around our hustle culture, sleep is one of the things that we tap into most without even realizing it sometimes. It's even worn as a badge of honor that some people can get through their days with 5 hours of sleep or even less. But this consistently cuts into the body's ability to restore and regenerate energy, thus equaling fatigue. And third is more of an environmental behavior pattern, and that is pushing through rather than pulling back. It really is amazing what the human body can do. And I see this in my high performers and executive patients all the time. But there are many people out there who are used to functioning and functioning quite well without fully having time to recover. These are all examples of where someone's stress chemistry and energy chemistry are suffering from the burning of the candle at both ends. They're continually taking more withdrawals from their energetic piggy bank, if you will, rather than making those deposits. And of course, the body responds to this, and one of the first signs is fatigue. In fact, a recent systematic review on sleep and fatigue found that disrupted sleep and poor recovery patterns were associated with chronic fatigue, which reinforces the idea that it's not just about what you're doing, but are you also able to recover from it fully? And if you're one who likes the research, I've included a few of the research articles that I used to create this video and put them together in a free research summary. It's easy to digest, and it's in the pinned comment and the description below. So that's a few of the environmental factors that contribute to fatigue. So now let's shift to a few of the internal ones. This is where most people start to look for answers, especially if their fatigue has been more persistent. But it also helps to think of these internal factors less as individual factors and more as different parts of your energy system. For example, nutrients and adequate nutrition status isn't just about avoiding deficiencies, which are where most of our daily limits are set in terms of dietary recommendations. Nutrients are directly involved in the way that your body produces energy at the cellular level. And so the conversation around optimization and personalization become very important. Iron is a really great example of this. Iron is primarily responsible for being a component of your red blood cells that transports oxygen from the air that we breathe into every tissue and every cell of our bodies. Oxygen is also an incredibly important ingredient for energy production. A review that was conducted in 2021 found that even people with lower iron levels that were not technically in the category of anemia still suffered from higher incidences of fatigue and low energy. So this is one of those examples where you can technically look normal on paper, but still feel the effects of suboptimal function. The next internal factor is a huge conversation around blood sugar balance. If your energy in the form of available glucose is constantly going up and down throughout the day, you see the peaks and the valleys, that translates into inconsistent energy in many individuals. If you happen to feel things like jitters or brain fog before you eat your next meal, that can be a very good indicator of blood sugar instability. And considering the number that 93% of Americans are technically metabolically unhealthy, and considering the recent statistics that 90% of Americans are metabolically unhealthy, much of that lives in blood sugar balance and its related chemistry. Another internal factor is the functioning of your thyroid gland. Your thyroid essentially regulates the pace of your metabolism and your energy production throughout the body. And the thyroid oftentimes is a scapegoat because it's reacting to signals higher up in the body, including our stress chemistry. So even if your thyroid is slightly underperforming, it can affect energy throughout the rest of the systems of the body, even though your TSH may look normal. And again, I like to reiterate that rather than thinking of these as separate problems, it's very important to think about your energy system as this deeply interconnected web involving nutrients and thyroid and stress chemistry and all of these things together. This is part of what makes tracing the source of fatigue so complex. We've talked both environmental and internal as two main categories, but I've created another category that I consider hidden or overlooked, and it bridges between these two main categories. These are factors that influence or cause fatigue that rarely show up on routine lab work, and it's something to consider if you're not making strides the way that you think you should. One is your gut and microbiome function. And this isn't just about whether or not you have digestive symptoms. Your microbiome and gut being diverse and flourishing and well supported determine everything from how much inflammatory burden your body's experiencing to how well you break down and absorb nutrients. Those nutrients, of course, are required for cellular energy production. So the gut and microbiome become a major player in fatigue. Another hidden factor is lingering or obscure infections. Many of these overlap with gut health, but they're not exclusive to it. And they don't always create obvious symptoms. We're talking about players from parasites to candida and other yeast infections. But their presence can place a slow burning demand in your energy resources as well and lead to fatigue over time. Environmental exposures can also play a huge role here, whether we're talking about mold and their mycotoxins or industrial chemicals, pesticides, household cleaners. Each of these can stress your chemistry systems that create your energy as well. And another hidden or often overlooked area is your mitochondrial function. This is one of my favorite areas to dive into with patients, but your mitochondria are your little powerhouses of your cell. This is where energy creation takes place. Many of the factors we've discussed so far can actually affect mitochondrial populations long term. And so even if you dial in your lifestyle factors and your nutrition and environmental exposures, your mitochondria still may need a little extra boost. And another systematic review on mitochondrial function and fatigue found that when mitochondrial function is impaired, energy production decreases, which can help explain why fatigue can persist even when other markers are not flagged as abnormal on standard labs. So these factors, aside from the environmental and internal factors being separate, are meant to clue you into the idea and fact that there are many hidden sources that we don't consider or work up regularly as well. When you start to put these pieces together, you start to realize that fatigue is often a multifaceted and systems-based experience. It rarely comes down to one factor, but there are some common sequences that I see quite frequently in practice. For many people, it boils down at the very top of the pyramid to stress chemistry, which ultimately affects the way your body is able to sleep and recover and also mount a resilient immune response. That poor recovery or the resultant hidden infections, for instance, can linger and task the system even further. Stress chemistry alone also influences blood sugar balance. And over time, that may create more inflammation of the body and ultimately draw more energy resources for healing and repair rather than true rest and recovery. And one of the most common stories I hear from patients is, well, I used to be able to do this and now I can't seem to do it as well. And I think that's a very important learning moment, that when we talk about especially cumulative stress chemistry and energy chemistry, what you did 5 minutes ago is even different in terms of your capacity than what you're doing now. Your resources in any given moment don't really care about what the past was informed by. And so your cumulative stressors over life matter. And what happens in many situations, especially when it comes to chronic fatigue, is that there's often a moment in your chemistry where there's a straw that breaks the camel's back moment. When I talk to patients about this phenomenon, sometimes I relate it to throwing out your back. If you've ever experienced that yourself or seen someone go through it, they could have been picking up a pencil, and the back pain that results does not necessarily equal the weight of the pencil. The same thing happens with our stress chemistry, and I think that's a very important lesson, especially when it comes to chronic healing journeys. And ultimately, what I see so commonly and what makes fatigue so frustrating is that from the outside, and even objectively with some standard labs, it can look like nothing's wrong. You get your labs done and everything comes back within normal range. You don't have depression, you don't have anemia, so what could your low energy be? What's often happening here is that these systems, and especially the ones that are not being tested for, like your gut and microbiome, are under strain. But that may not have crossed a threshold that is recognized as a formal diagnosis in our conventional paradigm. So the pattern and the energy draw and demand is there, but it's not being captured in a black and white way that is clear and easy to label. And that is unfortunately why so many people slip through the cracks when it comes to managing fatigue. A 2020 systematic review on nutritional status and fatigue highlights a very similar theme. What they found was that fatigue often is not explained by one single condition, and rather, it's often the overlapping of a combination of both nutritional status insufficiencies, but instead reflects multiple overlapping factors, including nutritional inadequacies as well as reduced functional resilience. So it's not that nothing's actually happening when you're experiencing chronic fatigue and brain fog and underperformance at work, for instance. It's just that your pattern likely doesn't fit into a clear, perfect diagnostic box. And if you're only looking for a single cause, or the smoking gun, if you will, it's easy to miss these patterns that are actually going on underneath. So hopefully seeing fatigue this way possibly changes the way that you relate to it or experience it. Instead of something to push through, it becomes feedback and a question to answer that helps you dive deeper into why that fatigue is occurring. If you're someone who's felt profoundly exhausted and can't seem to catch up, and you've had the labs done, they've come back normal, then you know what I'm talking about here. So what's happening inside your body when you have low energy, but everything looks right on paper? The video on your screen here walks through that exact question and how these patterns exist before anything ever becomes diagnosable. I'm Dr. Kenny, Root Cause Health Detective. Thank you for watching, and I'll see you in the next video.